Good day, everyone, and welcome. Thank you for joining us for today's webinar, From Awareness to Action, Turning Public Advocacy into Policy Wins. Our story begins long before TMJ was widely understood, before patients had clear answers, reliable guidance, or meaningful protections. For decades, individuals living with TMJ disorders were often dismissed, misdiagnosed, or worse, pushed toward treatments that lacked evidence and, in many cases, caused lasting harm. Patients were left to navigate a confusing and isolating system largely on their own. But within these painful experiences emerged something powerful, a patient community that refuses to stay silent, a community that recognizes that awareness alone is sometimes not enough to move the needle, because awareness without action does not lead to lasting change. That belief, that philosophy is at the heart of today's conversation. Advocacy is shaped by lived experience, persistence, and the courage to demand accountability. It is about transforming personal hardship into collective action and ensuring that public policy reflects the realities of the people it affects. We are honored to be joined today by Jennifer Feldman, founder of Oh My Jaw and a longtime TMJ patient advocate and friend of Fight TMJ. A board-certified patient advocate with advanced degrees in public health communication and law, Jennifer has spent nearly 3 decades turning her personal journey into purposeful change, testifying before the FDA, presenting at the National Academy of Medicine, and leading national efforts to improve TMJ care. Today, Jennifer will help us explore how stories become strategy, and how advocacy becomes legislation, and how communities can move from awareness to real policy wins.
Thank you. Thank you so much for that very nice introduction. One of the goals of Oh My Jaw as an organization is to turn some of this very high level information into digestible language, plain language, so that we can really understand what we're dealing with. So that's kind of the way that I will present, that I'm going to present this in a very easy to understand way. So first by saying that there's this question that it's almost hard to ask. It hurts to ask, like, if your knee stopped working, if it locked, if it cracked, if it swelled up, if it made it hard to walk, would anyone in this entire country say, I'm not sure this counts as medical? They wouldn't. You'd go get imaging, you'd get physical therapy, you'd see specialists. And if you needed surgery, nobody would act like you were asking for any sort of special service or special treatment. But the same question, different body part is what if it's your jaw? So, same joint, same idea, different joint, same problems: inflammation, degeneration, cartilage issues, structural damage, and the same outcome: pain, disability, and loss of function. But suddenly the system says, that joint's in your face, so we're going to need you to suffer quietly and figure it out because we haven't figured out where this joint belongs yet. And that's part of the majority of this presentation is kind of explaining this medical dental divide that exists, that's creating barriers to access to care because TMJ, the joint, and I know TMJ is not a diagnosis, it's just the name of the joint, but it is kind of fallen into a gray area. So this talk is about exactly that, because TMJ isn't just like a little jaw thing. It's not, oh, you're stressed. It's not, oh, have you tried relaxing? Respectfully, none of us can relax right now. And TMJ is a real medical condition that affects millions. And the coverage situation is basically a loophole right now. Everyone's just trying to find a loophole to get their coverage. So, so to introduce Oh My Jaw, which is pretty much runs parallel to fighttmj.org, in that we're trying to raise awareness, we're trying to create a grassroots movement. Um, the more voices, the louder we are, the better chance we will have at policy reform. So I just wanted to kind of introduce the organization because we work closely with fighttmj.org. Same mission, same vision and same goals, maybe different way to execute. So there's no wrong place to go when you're trying to help advocate and raise awareness. Um, so as I said, bridging the medical dental divide and what is TMJ and the scope of the problem. So we know that TMJ disorders affect this jaw joint, the hinge that lets you chew. I can go back to that picture. The hinge that lets you chew, speak, yawn, swallow, just pretty much exist. And it's one of the most complex joints in the human body, but it fails a lot. And the number of people is definitely underestimated based on the last big survey they did. But 33 million Americans are actively seeking treatment for TMJ pain. Whatever that means, we're still not sure. I don't think that that is even close to accurate in light of post-COVID, long COVID, people straining their necks to look at their telephones all day long, and just the fact that more people are living longer and having joint problems later on in life that they're starting to address. So it's not a niche joint and it's not rare. And so, how is this not a standard covered condition? Like when TMJ breaks down, people they're not just uncomfortable. They can't chew solid food. They can't talk for long stretches. Their jaws lock. Their face hurts constantly. They live on soft foods and like constantly planning out a strategy to get through the day. It's not cosmetic, and this isn't effective the way that we're working on things. This is a basic function. It's not an elective surgery, it's not an elective treatment. It's like walking, but with your mouth. It's like taking someone's kneecaps out and then saying, "Why aren't you getting up?" I mean, that's essentially why it makes no sense that the joint is excluded. So, the scope of the problem, which I just kind of went over, is that the joint sits between the dental and medical fields, and people don't know where to go. They struggle. Do they start with their primary care? Do they start with their dentist? And they're kind of getting kicked around because there are a lot of overlapping conditions that all require treatment. Some of those are covered depending on what doctor you see, and that's where there needs to be some more continuity of care. So, the ways that we're hoping to achieve these goals are increasing awareness, which we're working on with just the more organizations out there, the more people talking about it, the more posts, the more chatter, the better we're going to do. Um, you know, sorry, I'm having a hard time with my screen. Better health literacy, because I think there's a lot of confusion among providers, patients, and insurance companies about how to label orofacial pain that's also connected to an autoimmune disorder or maybe um, some sort of accident or cancer related diagnosis. So, between access to care, increased awareness, health literacy, and insurance coverage, there are a lot of things that could use work here. So, here's how we got here. Here's the short version. In the 1960s, when Medicare was created, dental got excluded. And not because our mouths aren't attached to our bodies, but because policy choices and lobbying and old school silos of medicine. So we built a system where oral health is treated like a side quest, and TMJ sits right in the middle of the chaos. So you can see here, this is a presentation that my daughter gave on my behalf in 2024, I believe. And even she in high school recognized that if she falls down and hurts her wrist, I'll ask her, "How's your jaw?" But no one ever thinks about that joint when you're dealing with any other accident. It's kind of like excluded. When you go into an emergency room and you've hit your head, no one asks you, "How's your jaw?" I get it. We're looking for concussions and things like that. But the long-term impact of not understanding how to treat and diagnose this problem is a huge minefield for patients. So medical insurance says it's too dental, dental insurance says it's too medical, and then the patient says, "So how am I supposed to pay for this?" So that's the gap. And it's not a lack of suffering by patients, it's a lack of categorization, and the people getting punished for it or the patients. So I mean, the slides kind of give the bullet points of why there's such a hard time with the communication between providers, but a lot of it goes back to things that happened 100 years ago, 75 years ago, that just they seemed like they made sense at the time. They didn't, and now it's really hard to change the way things have always been done when dental and medical sit in two totally separate camps, except oral maxillofacial and orofacial pain clearly cross over. We've established that. So here we just talked about this, that the patients paying out of pocket or just going without care, and the lack of care and the confusion. I mean, this is just kind of repetitive, but this is really, you talked at the beginning about lived experience, and there's really no way to quantify the cost of TMJ just in the dollars, because you have to look at the aggregate of it. What happens to patients who don't get treatment because there wasn't insurance coverage? It leads to this cascade of symptoms and worse problems and mental health issues and financial burdens that leave families just absolutely devastated. So you can end up with years of appointments, every doctor giving you a different opinion, try this or try that, paying out of pocket over and over because you need something to help. And then just asking anybody that you know if they know anybody who knows anyone who's gotten relief, and trying whatever they try. So, as much as we'd love to say that evidence based medicine is where we need to start from, we also need to start just communicating with one another, because some of the things that were evidence based have now been debunked, and people are still holding on to old ideas. One of them being that, your bite determines your TMJ pain, and the research shows that your bite is not connected to it. So people are spending thousands of dollars on splints and appliances and physical therapy and braces, multiple rounds of braces, Botox injections, acupuncture, massage, consultations, and they're flying all over the country just to get an opinion. And those opinions aren't cheap. And then you come home and you have multiple opinions, and most patients are having to decide based on the finances of it, which is unfortunate. When it comes to healthcare, you don't want to shortchange yourself and go to somebody that you don't think is the best fit for you because they're the one that's the most affordable. I think a lot of people would agree that if you had to choose, that's where you would spend your money. At least that's my experience in my family from my childhood. So a lot of patients are told that this is, probably stress. There are documented cases of patients spending hundreds of thousands of dollars out of pocket and then still needing a total joint replacement. So this was the CBS story follow up about the bottomless pit of debt that everyone's going into. And I say everyone, meaning I don't like to use words like everyone, but the patients that are looking for policy change in this area of insurance reform and the doctors are all seeing the devastating financial side effects of this. So, a joint replacement that restores your ability to eat and speak should not be treated like an option. It should not be treated like something that is, I can't even think of the word that I'm thinking of right now. Elective. It's not elective. I get it. It's not an emergency situation. You're not being rushed into the hospital with a heart attack, but it's not an optional or elective surgery like a cosmetic procedure. But nobody tells anybody who needs a knee replacement to go start a GoFundMe page or to meditate on it. So I just think that there's a double standard when it comes to this highly misunderstood joint. And let me just get where I am in my, okay. So the argument in one line is that the joint is like any other joint. It's a synovial joint, just like your knee or your hip or your shoulder. It gets arthritis, it degenerates, it could require surgical repair, and there's no scientific reason it should be excluded from medical coverage. The only reason is a broken system, right? Insurance loopholes and decades of not our department. And this part that no one wants to say out loud, that TMJ disproportionately affects women, and women's pain has a long history of being minimized and miscategorized. And that's not a conspiracy. It's the same story with different symptoms that we see with other um, non-covered insurance problems for women. So we just talked about this. The TMJ is a joint that should be treated like every other joint. And this this comprehensive coverage piece is a little tricky because there's this conservative first trap, this step therapy trap, and I'm all for conservative care, but in the TMJ, conservative first can always be tricky because it could end up making matters worse for a patient who might have benefited from surgery first. So patients spend months or years cycling through expensive options that don't address the structural problem. And then by the time surgery is considered, and not everyone is a surgical candidate, but even if you're not a surgical candidate, you're spending out of pocket for all of these conservative treatments until you finally get to a point of desperation where you're like, operate. Nobody goes in saying, I mean, I don't want to use words like nobody and everybody, but most of the patients I talk to don't walk in wanting surgery. They want to get out of pain, they want function and relief. But it's more complex because to get to the point of relief, sometimes you have to do some damage before they can fix it, which makes the final outcome of the surgery that you should have had in the beginning less likely to be a positive outcome. So, for example, people that get irreversible dental work and bite changes and crowns without evidence that it's going to help the joint, and then you end up with this slow motion failure cycle. So you delay care, people are spending money, the condition worsens, and then they start all over again and they try and find someone new. And this isn't a careful way to be conservative when treating the joint. It's costly and it's procrastinating the inevitable. So delaying care costs more. Insurance don't love advertising, but they'll deny a $50,000 surgery and then pay far more over time or force the patient to try multiple appliances, dozens of physical therapy visits, repeat imaging, repeat consults, years of medication, ER visits during flares, complications from long-term medication use, and eventually many of them end up needing surgery. This is the expensive way. It's not the most economically sound way, which is a policy argument that could be made as to why insurers would benefit by covering this joint. It would actually save them money in the long run. And the research suggests that when definitive care happens at the right time, people have fewer doctor visits, rely less on ongoing interventions, and regain function. I don't know. My thing is not working. Hold on. Sorry. So covering TMJ isn't opening floodgates. It's turning off a faucet that's been flooding these families for years, trying to figure out how to pay for it. Just a couple of other things that I really wanted to talk about, which is the mental health disability ripple effect of this condition of TMJ disorders, whether we want to call it TMJ, TMD, TMJD. The ripple effect is that it doesn't just stay in your face, if it even starts in your face, and it affects everything from your sleep to your mood to your work to your relationships to your nutrition and your identity. I have a lot of friends who don't like to take their own pictures, who don't even recognize themselves in the mirror, and it could be a millimeter here or a millimeter there that might seem insignificant, and everyone says you look great, but when you're living inside a body and you look in the mirror and you don't feel well and you don't look like yourself, it's very jarring. So there's evidence of elevated depression, anxiety, and unfortunately suicidal ideation in this chronic TMJ pain community. So when insurance denies care, it doesn't just create medical debt. It, like I said, again, it creates this cascade of people having to drop out of school, losing jobs, needing disability support. Families become caregivers. Marriages are cracking under pressure. And when families drain savings or go bankrupt, it's not personal responsibility. That's a systems failure. So we need these policy recommendations of mandating insurance coverage for TMJ treatments. What is a TMJ treatment? You know, that's also up for debate because we talk to some people who say, I go for massage, or I go for TENS unit, or I go for mental health, or I go for Botox. Those aren't technically TMJ treatments, but they should be covered. It just needs the right code and approval from the powers that be. So, what are we asking for? We're not asking for any miracles, nothing luxury, not cover anything anyone wants. We're just asking for equity, that this is a joint disorder. It should be covered like any other joint, meaning if you have surgery from minimally invasive procedures to a total joint, plus hospitalization and anesthesia, the anesthesia and hospitalization should be covered. A lot of patients will pay and then they get these bills from third party providers that were in the operating room or that were connected to a hospital system, and it's not price transparent, because even if you get approval up front, they could then deny it after, deny certain pieces that the surgeon billed for things he had to do that he didn't know he was going to have to do till he got in there. Dental and orthodontic care, when medically necessary for a lot of patients to have surgery, they need to have braces put on. That's not ever covered because orthodontics is not connected to health medical, even though they're surgically necessary in order for this to have a positive outcome. So it's very confusing. And especially when you deal with rehab and therapy, a lot of people are told to go for physical therapy. Finding a physical therapist who's well versed in TMJ and understands the insurance conundrum is is next to impossible. And finding somebody that's not hundreds of miles away. I mean, they're few and far between. Luckily, I'm in Manhattan, so I have access to probably a lot more in the tri-state area than someone living in the Midwest. But I could be wrong. Don't quote me on that. Um, so orofacial pain, we need better access to those specialists and their nerve blocks and Botox when appropriate, and just their diagnosis from the start so that we can get some conservative treatment and informed integrative options, which we've always talked about, like acupuncture and biofeedback don't really fall under medical or dental, but yet they're very necessary as an alternative when years of meds and escalating interventions are not helping a patient. So the right care at the right time without insurance, acting like it's bouncing people out of some like VIP club. We're not special. We're just patients who have um, a joint problem that somehow has fallen through the cracks of insurance and policy. Or maybe it didn't, maybe on purpose they're choosing to keep it where it is. But from what I've heard from all of the providers and patients that I've spoken to, outside of wanting to know who is having the most successful outcomes with treatment, the one thing that people really want to see happen is policy reform in the area of insurance, because it's become it's so divisive that it's almost like you have to be in a certain tax bracket in order to qualify for care for TMJ because it's going to come out of pocket. So a lot of people go without, which is really unfortunate. So right now, we'll go with it. Right now, TMJ coverage is basically a state by state lottery. Some states mandate coverage and many don't. So two people with the same jaw can have totally different outcomes. One gets care and one gets debt just because of where they live. And that's not healthcare. That's playing with zip codes. But the good news is that we're building some momentum, and the National Academies already said TMJ care is broken. There are bills to expand Medicare and dental benefits, and states like New York are moving to categorize TMJ clearly as medical. But more policymakers finally acknowledging what patients have been screaming for years, that oral health is going to make all the difference. So I think the patients coming together with the providers who are recognizing that this is something that's going to go beyond a dental insurance cap within one appointment. So we need to do something so that patients can get relief and can get treatment, especially ones that are, underserved populations. TMJ is the bridge issue that forces the system to stop pretending that we don't have a siloed system. I mean, it literally is the joint that connects your lower jaw to your skull. So it still boggles a lot of minds when I tell people that it's an exclusion and they just never really thought about it before. And I think one of the important things is to recognize that we who live in a TMJ advocacy kind of echo chamber or bubble, we assume that everyone knows what we're talking about with this stuff. And sometimes when we go into a conversation, we go in explaining the solution before we explain to them how we got to the problem in the first place. So I think from a policy perspective, it's most important to really understand how we got here, from dental schools like not including it in the curriculum, to Medicare not including, separating dental from medical. From 2020, we have a new dental specialty, orofacial pain. They're trying to figure out how to navigate this, whether it's, you know, out of pocket or if they can work with another provider and get insurance. And it's very hard for them to give a patient advice on where to go when they know there's a financial toll connected to it. And I think it's important to look and see what other countries are doing. I mean, there are other countries that are dealing with TMJ with different healthcare models. I don't know that they're having more success with the insurance coverage or that the patients are more satisfied, but I definitely think it's something that deserves looking into. So as far as the future of TMJ advocacy, as simply as I can put it, no one should have to choose between eating, talking, or paying their rent and buying groceries. No one should have to fight two insurance companies who agree on only one thing, which is that neither of them want to pay. And no patient should be treated like their pain is optional because it's hard for a provider to categorize it. This jaw is a joint. TMJ disorders are real. Coverage should be clear, consistent, and humane. And this is fixable. And honestly, it's one of the most obvious fixes in American healthcare if we're willing to stop letting the mouth be the loophole. So I think, the most important part now is to start collecting patients who are willing to get involved in the policy reform piece of this. And it requires patients all over the country reaching out to representatives at, all levels, even though the government's kind of in a bit of a messy place right now. You still have to keep, moving forward, even when things seem um, not so positive in terms of getting this pushed through. You just can't stop pushing for it because this has been going on now since I'm 15 years old and I'm 52, and this is the one spot that no one has really made any significant advances in getting coverage for this joint, which is clearly, yes, I get it. Your jaw houses your teeth and your teeth are dental, but your jaw also connects to there's neurological, there's ENT, there's rheumatological, there's eye issues. There's so much more to it than to just throw no disrespect to dentists. They have a very important role in this, but it's going to take a collaboration between medicine and dentistry, and it's going to take both of those camps to press for policy change on insurance reform, and private companies and device companies and pharma companies that have an interest in this patient population would be helpful for them to be on board as well. And then influencers who have a platform and a voice, who are willing to share their lived experience, have tremendous social capital that really can't be overstated. So I think I'm going to wrap it up. I hope I said something that was useful, but I just kind of wanted to keep it at surface level as to why we need policy change and why insurance exclusions are so devastating to patients. So does that help, May, for me to Mao, sorry, for me to wrap up there?
Yeah, we have a few questions though. Are you open to answering some?
Sure. Yeah,
All
sure.
right. We have a few that just came in. So the first question is, they seemed a bit interested about TMJ care being subject to zip codes. So I think this is incredibly damaging. So have there been efforts to harmonize care and address the siloed care problem with TMJ?
I mean, the issue with the zip codes is that every state insures and covers differently in the United States. So if you live in Florida, what your insurance coverage for an MRI or a CT scan reimbursement is going to be different than if you live in New York based on the cost of living and the their rates and their metrics that are used by insurance companies to determine how much a treatment should cost in a certain state based on their state guidelines. So if you're somebody who is going to Boston or Pennsylvania or California for treatment, you're kind of at the mercy of whatever their pricing structure is and how insurance covers it state by state. What's been done so far, there are people working behind the scenes trying to deal with the insurance companies, but it's very hard because even though insurance companies are national and international, they're dealing with different state statutes and different corporate, when you have employer insurance, they can choose whether or not they want to opt out or exclude certain things
Mhm.
based on the premiums that it's going to cost them. So it's really something that people shouldn't have to be choosing their jobs based on whether their insurance might cover their TMJ care one day. It should just be baked in.
So that's interesting that, some employers, they're not really seeing eye to eye on whether they should cover TMJ care. I think that's crazy because I think in the Philippines, that's not exactly the case. I don't think we know a lot about TMJ either. So yeah, I think that's incredibly distressing for patients. I mean, I can't imagine having to go from one state to the other and like have your treatment suddenly impeded or changed without warning because of conflicting insurance terms. So that's
Yeah.
that's crazy. So another thing is, this is from me. So you mentioned TMJ conservative treatments may be complicated, since it's true some patients with specific conditions may require the sophisticated treatment of surgery. In my university, we're taught that, when you triage a patient, you should always triage based on severity and their need for the treatment and the outcomes that they want. So I totally agree with that. And with specific conditions that require, this complex intervention, I think it's unsettling as well that some medical insurance companies, from what I've read, they push patients into, getting the surgery first. And how do we strike a balance between prompt triaging and, yeah, and what's that? Avoiding irreversible damage. So
I
since
I
surgery
think
is irreversible.
Yeah, no, I think what you said is the perfect starting place, which is the triage. And you walk into an emergency room, they're not taught to even assess a temporomandibular joint. And yes, surgery is irreversible, but so is some of the damage that's done by some of the conservative treatments. So having to, I've been to doctors who said to me, before we do surgery, I need you to do these other treatments first. Those treatments ended up creating scar tissue or a more unbalanced bite or more discomfort before surgery, which the outcome, the positive outcome of a surgery after you've had other conservative treatments can sometimes be detrimental. So I'm not saying anybody should jump into surgery at as a first line of defense, but what I am saying is if you are properly diagnosed and somebody says, no, this is a definite case that needs surgery, you shouldn't have to make a decision of whether or not you're having that surgery based on whether or not your insurance covers it.
Mhm. So this is also a matter of delaying care because some populations are economically disadvantaged. So yeah, for that, what about patients who unfortunately refuse such treatments? For me, I think apart from the COVID-19 pandemic, there's also a pandemic of medical misinformation and medical distrust within the general population. I mean, the realm of medicine has at times failed certain populations and it fostered a sense of distrust. So there are some people, especially in the Philippines, who distrust traditional healthcare, such as surgeries. And I think every country has that sort of sentiment. I mean, we have people who refuse certain treatments because it's, it's in conflict with their religion, with their cultural beliefs. So with something as complicated as TMJ, how do we make sure that people are getting the care they need without, without culturally impacting them or socially impacting them while keeping them safe from economic disadvantage? Because I was reading some of the articles and I said, I think it's insane how people have to get a second mortgage to, to get the care they need. So how do we make sure that people are adequately educated to get the care they
I think that's really what, Fight TMJ and Oh My Jaw are all about, which is
need?
providing information to the patient population outside of just show me what your scan is, what did your doctor tell you your diagnosis was, to having them understand what questions they should be asking before they move forward with any treatment, what questions they should be asking their insurance providers, what, you know, there's nothing wrong with getting a second opinion, but understanding the dynamics of this small community of specialists and how it could impact your relationship with a potential provider and being transparent with all of your doctors and asking the questions and not leaving until you get answers that you're satisfied with. A lot of people feel, even though there is this overall distrust for the medical establishment, most patients still are intimidated to push back or question their doctor when he gives his opinion because it's I went to medical school. What's your experience? It's like I'm
Yeah.
living with it. That's my experience. My experience is that I've been living with it, and until you've walked in my shoes, I'm not going to tell you how, there's no way to create the level of empathy in a population of providers who doesn't even understand the root of the problem. So I think we start with the education piece, educating the providers so that when patients come in, they're not dismissed. Most patients are dismissed when they ask too many questions. And when I say dismissed, I mean kind of like fired as a patient.
Can you elaborate on that? I mean, I'm aware of medical gaslighting, so I've heard of the term
This
before.
is worse. This is worse than
Yeah.
medical gaslighting. This is going to a doctor, having surgery or having treatment, multiple rounds, and then you saying, uh, I'm not feeling any better, I'm feeling worse, and forget them gaslighting you and telling you there's nothing wrong with you, saying, I will no longer treat you. I am dismissing you from my care, abandoning care. So now this patient who has had multiple treatment plans and surgeries potentially, it's very hard to find another doctor to pick up where someone else left off, especially when they look at it and they go, that's not how I would have gone about it in the first place. So they don't want to fix anyone else's, I don't want to call it a mistake, but clean up something that they don't even know what they're getting into because the scans are so hard to read. There's a lot of artifacts in a lot of patients' faces with braces and things like that. So once you're, the gaslighting is a whole other story with just, making people start to question their own reality and whether or not this pain is real and where it's coming from. But then on top of it, to put your life in the hands of physicians and then have them say, I don't see anything wrong on the scans. You shouldn't be feeling this way. And not only is that gaslighting, but I can't help you anymore. I'm ending our relationship. And then that puts patients in a very vulnerable spot and a scary spot because they've invested a lot of money and time and trust. And I think that's where, having policy reform so that people don't have to feel like, oh my God, if I upset my doctor, I'm not going to find anyone else because there's no insurance coverage for this. No one wants to touch it. And I'm a mess now.
All right. So that's also something that, that's really scary because, you shouldn't have to be punished for, for a treatment failing. Oftentimes, there are a lot of confounding factors that lead to treatment failure. So do you think that policy reform should also include having a robust referral network between, TMJ specialists?
Well, first of all, I don't even understand what a TMJ specialist is. I think that's the issue right there. What's a
Yeah.
TMJ specialist, right? So I could tell you that I have rheumatologists who I know that specialize in TMJ and physical therapists who specialize in TMJ and general dentists and oral maxillofacials. So who is a TMJ specialist? If I said to you, if you said my jaw hurts and I said you should go to a TMJ specialist, what doctor is that?
Wow. Yeah.
Where do you
That's
go?
Yeah, that's a big question. Like from
Anybody
what,
can be a
yeah,
self-proclaimed TMJ specialist because there is no such thing.
yeah, like it's not exactly clearly defined like right
No, there
now.
is no specialty. If there were, or
Yeah,
so TMJ pain falls under in the pain spectrum, it would fall under orofacial pain. But that's if the pain is coming from the actual joint. Just because you have referred pain in your temporomandibular joint doesn't mean that you have a joint problem. It could be a referred inflammatory response to something else. There's there's Lyme disease, people that are suffering from inflammation. There's all kinds of pathogens. There's long COVID. There are other, the psoriatic arthritis, rheumatoid arthritis. There are other things that are overlapping comorbid conditions that to say to somebody, go see a TMJ specialist is really why Oh My Jaw was started. Because people will call me all the time. I have TMJ. Who should I go see? And I don't want to say there's no one to see. There's so many people to see. But are those people then going to talk to each other? And are you going to get an accurate diagnosis? Because if you go to one doctor who claims he's a specialist or she's a specialist, and they tell you this is the only thing that's going to work for you, I get 99% success rate from all of my patients. And then you go to somebody else who says, that guy is, he's lying to you. I fix all of his mess ups. This is the way to do it. You're making a mistake if you go there. Then the patient has to decide. They're gambling with their own out-of-pocket money on which provider made the best sales pitch.
wow. So there's also like because there is a lack of, clearly defined like standards when it comes to TMJ care. Yeah, I totally agree that that's sort of like gambling. It's like looking for a needle in the proverbial haystack.
Yeah.
Like that's insane. So,
I mean, they are putting together standards, but those standards, in my humble opinion, are not adequate for the breadth
mm,
of this problem.
mm. So like as you know, I'm Cameron's assistant. So like I had access to a particular interview that you did with Dr. Robert Neer, and I hope I'm pronouncing his name right.
Fine,
And
yeah.
I like the idea of, satellite clinics. Like I think you mentioned something like that, like having a specific clinic per state where the worst, TMJ cases go for multidisciplinary care. So how close do you think we are to implementing something like that?
I think there are three that I can think of that qualify as that are still fleshing out some of the details on how to make sure that it's comprehensive and all encompassing. But like centers of excellence for TMJ, if we had one or two and they could put together, almost like a prototype for other schools and academic institutions or physicians to follow. It's more, again, it has to do with the standardization of care, you know? So we can put together this great Mayo style clinic just for TMJ patients, but it's not going to be, if there are 33 million Americans that we know of that are seeking treatment, they're not all going to be at the level that they need that kind of care. Some of them will just need very conservative treatment. Change your eating habits, change, maybe some of the medications you on are causing you to clench and grind, and it could have to do with environmental factors. So it's hard to say that, putting a clinic in every city is going to solve the problem until we get insurance to cover those, you know, fees.
Yeah. Although it's something that I'm quite looking forward to. Like, I think that thing could really benefit a lot of people. At least, there's some guided direction. I'd like to like take us back now. I mean, I'm currently in pharmacy university, and like right now, we have a class in public health that forces us, or rather that encourages us to, communicate with medical students, with public health students. And like, do you think that, if we implement such a thing, like such an educational framework in the US, wherein, dental students aren't just talking to themselves about TMJ care, but they're also talking to other departments. Do you think that that could help in the
I
long
think that
run?
could help, but I also think that what helps most is students talking to patients that aren't necessarily their own,
Mhm,
right?
mhm.
Hearing different experiences before, not everything is a clinical, oh, this is the mechanics of the joint here, you can see the influence, like having the lived experience storytelling so that providers and students coming out of school understand how to recognize certain patterns, certain lifestyle choices that could be impeding the outcome instead of just looking at the hard raw data. Like there has to be more qualitative research in this area. There has to be more ethnography. We have to look at the patient population and what's impacting their health instead of just zeroing in on the joint and saying, if the pharmacy talked to the oral maxillofacial, great, you guys could all talk to each other. But if the patient isn't involved, if they're not top of mind as let's do the best interest of the patient instead of the best interest of the bottom line of the hospital or the doctors or the drug companies, that's where I think you're going to see change happen.
And I think it builds empathy as well. From what you've mentioned, I think a lot of doctors can, benefit from having like that kind of exercise as well, like in empathy, because, it's so easy to get caught in the human emotion that, oh, I went to medical school. I know better than you, so you should listen to me. So unfortunately, that's a reality, like right now in, the medical landscape, wherein doctors feel that, you know, they could be a bit like they could leverage their years in medical school against a patient who's unfortunately suffering from all of these these painful experiences that they go through every day. So I totally agree with that.
And
So
those physicians all
mhm,
earned their right to feel a sense of, you know,
yeah.
they're credentialed for a reason. We go to them for their expertise for a reason. But
Mhm.
in order to get a full picture and treat this holistically and from a multidisciplinary point of view, it takes more than just I studied harder than you in school or I took,
Yeah.
I have this degree. Because your degree isn't as important to me as your patient outcomes. People
Yeah.
want to hear about positive outcomes. They don't want to see, maybe they do, maybe I'm wrong, but like where your degree is from is not as important as what patients are saying their outcomes are.
Like at the end of the day, it's, how many lives that you better. So public health advocates like Oh My Jaw and Fight TMJ often face organized opposition. So there's from the industry, There's from institutional inertia and budgetary priorities, like you've mentioned. So, what kinds of counter arguments or opposition are we currently facing in the TMJ space? And how should we prepare to respond to those barriers?
I mean, I think you're always going to come up against people who have different philosophies and different belief systems when it comes to this very misunderstood, underfunded, under-researched joint. So I think that the best way to go forward is for everyone to respect everyone else's voice and willingness to put time and energy into raising awareness, whether or not it aligns with your um, clinical or belief system. All awareness in this space is important right now because, as much as, like I said, we all think everyone knows what this is, more times than not, when I say TMJ, people look at me like confused. So, again, we all start to live in a world where we talk about it so much, we think everyone knows what it is, and they just don't. So, I think the best way to counteract it is to um, kill one another with kindness and reach out to other organizations and other device companies and other patients and other forums and say, look, we can't do this if we don't all get in the on the same page in some way. We don't have to agree on everything, but we all have to be in alignment that this requires positive change in policy areas. How we get to the positive change, that's a different discussion. But just to be in agreement that there's a need for policy change is a huge hurdle because not everyone believes that this should be covered by insurance for their own specific reasons, which I'm not going to speak to. But everyone has their own agenda and reasoning, and it's all valid. But at the end of the day, as patient advocates, we're looking out for the patient's best interests. And the patient's best interest is to not be bankrupted by needing to pay for their own health care.